We continue with Peter Attia's Outlive, and this is the sixth part of the interpretation. Today, let's talk about the fourth of the four horsemen. Neurodegenerative diseases, specifically brain degeneration, with Alzheimer's disease being the most typical. Alzheimer's is a form of dementia. In recent years, there have been public service ads about Alzheimer's, often portraying a poignant narrative. The elderly in these ads lose many memories, fail to recognize family members, and may even forget their own names. Yet, they retain an instinctive sense of love and memories of their children in their early years. However, Alzheimer's is not always this way. Alongside memory loss, patients' emotions become highly unstable, because they no longer comprehend their surroundings. They might live in constant anxiety and fear, become depressed, irritable, and even lose their sanity. As dementia progresses, functional impairment sets in, making even basic life tasks challenging. The mental decline and breakdown are comprehensive. In the past, people didn't consider this a disease, thinking confusion in old age was normal. It wasn't until the 1960s that senile dementia was recognized as a disease. However, the term senile is imprecise. The reality is that some people start showing symptoms from middle age. Why call Alzheimer's a disease? Firstly, it's a physiological symptom. Confusion isn't just a change in thinking. The entire hardware of the brain undergoes significant alterations. In the left half of this image is a healthy brain, and in the right half is an Alzheimer's brain. You can see severe atrophy in the patient's cortical layer, particularly extreme shrinkage in the hippocampus. This patient's brain has withered and diminished. Now, you might wonder, since everyone dies, isn't it normal for the brain to shrink? Not quite. The second reason Alzheimer's is considered a disease is that not everyone will get it. To a large extent, genetics plays a role in this disease. If you undergo genetic sequencing, pay special attention to a gene closely linked to Alzheimer's called ApoE, mentioned earlier when discussing longevity genes. Other genes play a role, but ApoE is the most crucial. If you think of all human genes as a piece of writing, with each gene being a sentence in a fixed paragraph, everyone's writing length and paragraph format are the same. However, the sentences, or genes, may vary slightly. We all have different versions of genes. Human chromosomes come in pairs, one from the mother and one from the father. On your chromosomes, you have two ApoE genes, one from each parent. They could be the same version or different. The ApoE gene has three versions: E2, E3, and E4. You inherit one version from each parent, and this is a sort of lottery. E3 is the most common version, considered the baseline. If you draw E2, you're fortunate, because E2 reduces the risk of Alzheimer's. For instance, if you have E2 and E3, your risk of Alzheimer's is 10% lower than someone with two E3 versions. If you draw two E2 versions, the risk decreases by 20%. But if you get E4, that's unlucky. If you only get one E4, your risk of Alzheimer's is twice that of the E3 version. And if both versions are E4, your risk increases 12-fold. If a person, he has two E4 versions, without strong intervention, there's a significant likelihood of developing Alzheimer's in old age. Using the pronoun he throughout might be inaccurate, as the number of female Alzheimer's patients is twice that of males. It could be due to longer female lifespans, or physiological reasons like menopause. This E4 version of the ApoE gene poses a challenge. However, in certain environments, it may confer an advantage. In unsanitary conditions prone to infectious diseases, like slums, individuals with E4 are more resistant to diarrhea, improving their chances of surviving to middle age. Additionally, their cognitive abilities may develop more quickly. This advantage is possibly because E4 tends to promote inflammation. Some level of inflammation can activate the immune system, a beneficial trait in harsh environments. However, in today's generally hygienic conditions, the advantage of E4 is diminished and even becomes a disadvantage. But a cognitive issue remains. What does the ApoE gene do to the brain? Even if you have E4, can you do something to counteract its effects? The ApoE gene has two main functions. It participates in the transport and processing of cholesterol, especially in transporting cholesterol within the brain. Additionally, it has a significant impact on glucose metabolism. This points to the importance of cholesterol and glucose within the brain, which, in turn, depends on the energy delivery capacity of blood vessels and the quality of the vessels themselves. However, the macro and micro perspectives are different, and scientists find it challenging to directly deduce macropathology from microfunctions. Let's first understand the macro situation of Alzheimer's. This diagram illustrates it well. On the left is a healthy brain, and on the right is the brain of a patient. We focus on neurons, represented by the green structures. Alzheimer's neurons exhibit two characteristics, and for doctors, these two features define Alzheimer's. The first characteristic is the production of amyloid beta near the synapses, the tentacle-like structures extending from neurons, which, when in excess, form plaques and ultimately cause neurons to lose their connectivity. The second characteristic is the appearance of tau proteins in the main branches and cores of neurons, triggering inflammation. In severe cases, it leads to tau tangles, resulting in the overall atrophy of the brain. Current medical standards define Alzheimer's when these amyloid plaques and tau tangles are present. Some scholars suggest that the disease might be reversible if only amyloid plaques are present, but once tau proteins appear, it's a one-way path, and the brain continues to atrophy. The pathology seems clear, so one might think that if there's a drug that can eliminate these amyloid plaques, wouldn't it cure the disease? It's not that simple. Currently, there are dozens of drugs specifically targeting amyloid plaques, some successfully clearing them, and some slowing down their formation. However, none of these drugs have managed to improve patients' cognitive function or slow the progression of the disease. Every drug developed based on this approach has failed. Scientists have noticed two phenomena. One is that 25% of normal individuals, without Alzheimer's symptoms, without dementia, upon autopsy, have significant amounts of amyloid plaques in their brains. In some of these cases, the plaques resemble those in severe Alzheimer's patients. The other is that some people show clear symptoms of Alzheimer's, a significant decline in cognitive abilities, yet their brains have almost no amyloid plaques. This challenges the notion that Alzheimer's is defined by amyloid plaques and tau proteins. There might be other reasons. Currently, there are two hypotheses. One hypothesis suggests that insufficient blood supply to the brain is the cause. The brain is the most energy-consuming organ, constituting only 2% of body weight but consuming 20% of energy. If, due to bodily reasons, blood vessels degrade, leading to insufficient supply of blood, glucose, and oxygen to the brain, problems arise, possibly leading to dementia. Another hypothesis argues that Alzheimer's is caused by abnormal glucose metabolism in the brain. From insulin resistance to type 2 diabetes, these conditions can lead to prolonged high blood sugar, potentially harming the brain's blood vessels. These mechanisms align with the functions of the ApoE gene. Another crucial discovery is the relationship between insulin and cognitive abilities. Experiments have shown that providing a small amount of insulin to the brain through the nasal cavity not only improves cognitive abilities, but also helps maintain brain volume in Alzheimer's patients. These studies haven't provided final conclusions, but they offer some hints. Alzheimer's might not be inevitable or irreparable. If insufficient blood supply or glucose metabolism issues are indeed the causes of Alzheimer's, then maintaining the health of the metabolic and cardiovascular systems is also helping the brain. Attia's conclusion, based on various studies, is that what's good for the heart, liver, and pancreas is also good for the brain. This becomes a holistic issue of bodily governance, with the means being exercise, diet, sleep, emotions, and medication. We'll delve into the specific details later. Here, let's discuss two interesting, effective discoveries you might not have thought about. One is the strong correlation between dental health and Alzheimer's. If your teeth have problems, it keeps the blood vessels close to the brain, leading to chronic inflammation. Detrimental to the brain. Some have found periodontal bacteria in the brains of Alzheimer's patients. So, even for the sake of protecting the brain, you should regularly brush your teeth, use dental floss, and have regular dental checkups. Another intriguing method is to go for a sauna. Attia's research suggests that if you sauna at least 4 times a week, For at least 20 minutes each time, at a minimum of 82 degrees Celsius, you can reduce the risk of Alzheimer's by 65%, and the risk of acute cardiovascular disease by 50%. This reduction is more significant than the effect of the E2 gene. Research I found suggests that sauna may reduce inflammation, although it's not clear if that's the reason. If you believe in this method, having a small sauna at home is also feasible. Alzheimer's is not the only neurodegenerative disease. Other common ones include Lewy body dementia, which has two types. One manifests as cognitive dementia, while the other is the well-known Parkinson's disease, characterized by motor impairment. There are also diseases like Lou Gehrig's disease, Huntington's disease, and more. Interestingly, all these neurodegenerative diseases are interconnected and linked to the ApoE gene. This means that actions beneficial to Alzheimer's can also benefit other neurodegenerative diseases. So far, we've covered the principles of the four horsemen roughly. Among the four horsemen: 1. Metabolic dysfunction is the most basic, directly impacting the other three diseases. It is also relatively easier to reverse. 2. Cardiovascular disease is the biggest killer, but surgery can be done in emergencies, and the overall mortality rate is decreasing. 3. Cancer is challenging to prevent, but sometimes it can be treated. 4. Neurodegenerative diseases are the most challenging to treat. These diseases have deep principles, and their causes aren't due to people doing something wrong or encountering rare dangers. They quietly develop. They seem like inherent settings in nature, intentionally opposing human survival. Longevity can be seen as a kind of defiance against nature. But under current conditions, we can indeed take some action. Perhaps a new era is beginning. From the next part onwards, we'll discuss specific operational methods.
If you feel there is value in this, please like, subscribe to this channel, and leave your thoughts or suggestions in the comments section. Let's grow together and read more good books.